So my name's Ben Eddy. I'm a consultant urological surgeon. I spend a lot of my practice dealing with men with prostate-related problems, predominantly enlarged prostates. This is a very, very common condition and increases with age as men get older. It can be really quite debilitating for a lot of patients. It can cause a lot of symptoms. And we here at Ashford talk a lot about men and their symptoms, how we investigate it, and how we can manage that. So men come to us with lots of different symptoms related to their urinary system. One of the most common symptoms is what we call nocturia episodes, or getting up at night to pass water. And that can increase as men get older. Men in their 70s would commonly or would normally get up maybe just once a night. But if you're getting up 4 or 5 times a night, this can be abnormal and can be a sign of either prostate, bladder, or potentially other conditions that do need to get investigated. Other symptoms during the day include a slowing of the urinary flow, a pause, hesitancy before you pass water, or the stream just comes out in a dribble, a stop-start. We call that intermittency. In addition, urinary frequency, so you're passing water little and often, and then that can become a real bother for a lot of our patients, and a feeling like you don't empty your bladder properly. Occasionally, and in more severe cases, recurrent urinary tract infections can be a symptom, or indeed blood in the urine. And if men were to get these more worrying signs, they must seek help from their GP or from their urologist. We very commonly see men with these symptoms. And our job really as urologists is to work out whether it's related to the enlarged prostate or to the bladder or potentially to some other conditions. We would start off with some basic questions and ask the patient about their history, about what bothers them the most, and we tend to get them to fill out a recognised, internationally approved symptom score so we can gauge the severity of their symptoms. In addition to that, we will then examine the patient, and part of that examination is to examine the prostate. This is a very quick and simple test. We can gauge roughly size of prostate, but more importantly, we can help to rule out prostate cancer as a cause potentially for these symptoms. After that, we will test their urine to make sure there's no evidence of urine infection, and then we will do some flow tests where we get men to pass water into a machine that measures the speed that they are passing water. And if they do indeed have a slow flow, that can certainly point to problems related to the prostate. And we also scan their bladder to make sure that they are emptying their bladder properly. In addition, and in some selected patients, we may opt to want to look inside the bladder if they've got other symptoms, or other investigations, more advanced investigations such as ultrasound, scans, or indeed urodynamics. But all these would be discussed with the patient depending on their needs. Treatment is multifactorial. We start with assessing patients' lifestyle and see if we can just change some of their lifestyle measures that can improve their urinary symptoms. Simple things such as stopping caffeinated drinks, adjusting alcohol intake, adjusting fluid intake in the evenings, or indeed double voiding, which means passing water twice, maybe 10 minutes apart before going to bed. These just basic things can improve symptoms like getting up at night to pass water. So we talk to patients about that and how just to change things in their life that may improve things. We also assess how much these symptoms are really bothering them, and we will treat patients based on how much it's affecting their lives. First-line treatments tend to be medical, i.e. tablet-based, and we have tablets that relax the muscles around the prostate and the bladder neck area and can improve a flow rate and improve bladder emptying, and also tablets that can just help shrink the prostate. And a lot of men get benefit from these tablets and don't need to go any further, and these tablets are safe to stay on those long term. If they fail, or they're not good enough, or symptoms are more severe, then we may think about a surgical option. And the surgical options are discussed with the patients. The gold standard is what's called the TURP or TURP, transurethral resection of the prostate, or indeed we can do that with the laser technology. But the end result is the same. It's to carve a channel of the prostate, like taking the core out of an apple, to widen the channel to allow men to pass water better or more freer. There are also some newer techniques that we can use as well, which are less invasive, but we're a bit more selective on the men that we may use those on, and that's discussed with men in the outpatient setting. So lower urinary tract symptoms or waterworks symptoms are very common in men as they get older. It's a very common neurological problem, and it is a problem that we can help with and we can improve a patient's symptoms. And so if men have any concerns around this, then please go and ask your GP for advice or ask for a referral to your urologist here at Ashford.